This presentation will explore the role community and public health organisations play in promoting health and healthy eating habits. Public health use organised measures such as policies, disease research and education to prevent disease, promote health and prolong life among the population as a whole. It can be accessed by the whole population and its main focus is protecting the safety and improving the health of the whole populations. Community health provides access to primary healthcare services in a community setting, as well as targeted services for vulnerable population groups to meet local community needs. It can be accessed by local individuals and community groups, and its main focus is to meet the health needs of the community and reduce health inequality for local population groups at risk of poorer health outcomes. It is expected that public health are involved in the planning, policy development, funding and regulation of health service providers. They are involved in conducting needs assessments of whole populations which they use in their planning for policies and programs. Community health services are expected to involve local community groups and use local demographics to respond to local population needs. These are the Australian Charter of Healthcare Rights and they apply to all healthcare services anywhere in Australia, including public and community healthcare settings. They allow patients, consumers, carers and providers to have a common understanding of the rights of people receiving healthcare. Caulfield Community Health Services aim to provide comprehensive services in their centre, local community and home-based settings with health professionals and health promotion activities. They provide health services to people who live, work or study within the northern half of the city of Glen Eira and the eastern three-quarters of the city of Stonington. Caulfield Community Health Services operate within Caulfield Hospital and is integrated within Alfred Health and therefore is guided by the Alfred Health population health priorities. These are overweight and obesity, nicotine dependency and healthy ageing. These are the services Caulfield Community Health provides. When planning these services, a comprehensive needs assessment of populations within the catchment areas was undertaken. This assisted in the prioritisation for health services and programs that address the needs of the community most effectively. This led to the development of the key priority areas, which are healthy families and healthy ageing. This is a checklist of what a good community health service looks like. To develop this, I have used the guidelines from the Community Health Integrated Program, developed by the Department of Health and Human Services. I have also used the Australian Charter of Healthcare Rights to help me identify what elements make a successful community health service. The delivery of culturally responsive services is a main focus at Caulfield. Needs assessments and demographic profiles are conducted regularly within the catchment areas to help Caulfield Community Health stay up to date on the cultural needs of the community. Recent funding has been provided for a new language service at Caulfield Community Health called the Language Services Credit Line System. The credit line provides access to on-site and telephone interpreting services, as well as a translation service. Being culturally competent allows healthcare professionals to understand and be aware of the cultural elements that influence a patient's beliefs surrounding their health and wellness. Being culturally competent has a positive effect on patient care delivery, as it allows healthcare practitioners to deliver services that are respectful to the client's health beliefs. Cultural competent practitioners are always open and willing to learn about their clients' cultures.